Community Analysis City of Miami, Vanessa Alza Morgan, NUR 4636, September 28, 2016. Photograph display. Historical overview. Native American Indians were the inhabitants of South Florida before Juan Ponce de Leon from Spain made landfall in South Florida in 1513. During the 1700s, there was a large amount of American Indians in South Florida due to the United States land expansion forcing Native Americans out of their lands. By 1819, the United States purchased Florida from Spain, and thus came three major wars between the Seminoles and the United States government, which is why the area was not settled until the 1840s. Near the 1840s, on the south bank of the Miami River, the village of Miami was developed. Julia Tuttle was a wealthy woman of the time and convinced Henry Flagler to extend the railroad track he owned down into South Florida. In July of 1869, the city of Miami became incorporated, boasting 444 citizens. Henry Flagler also built streets, power systems, water systems, and a resort hotel. Canals were also built in order to drain water from the Everglades. Other important figures that are responsible for transforming the city of Miami include John Collins, who built hotels in Miami Beach, and Carl Fisher, who commissioned to build South Dixie Highway nightclubs and many shops. Once the Great Depression hit in the 1920s, along with several hurricanes, the boom in Miami began to fade. The Art Deco era came after the Great Depression and World War II, which in turn helped boom the local economy. Many servicemen trained and returned to South Florida with their families in the 1950s, because many servicemen trained in South Florida. When Fidel Castro took reign over Cuba in 1959, there was a large influx of Cubans that fled into Miami. During the 1970s, there was a huge immigration of Nicaraguans and Haitians who also fled their countries due to their governments being toppled. The last major influx of immigrants occurred in 1980, where 150,000 Cubans came to Miami via the Mariel boat lift. Structure of the community analysis. Structurally, the city of Miami strives to meet the needs of the community. For example, there are services catered to citizens in the community in needs, such as the elderly, disabled, and the homeless. Services provided include youth services, child care services, and housing assistance for the homeless. Mass transit is accessible, but when Windshield's survey was conducted, it was noted that there were several bus stops, but no buses were observed making stops, nor many covered benches to shield from the heat and rain. In comparison to the city of Miami and the village of Palmetto Bay, there are several similar services available to citizens, such as mini buses to transfer citizens within the city of Palmetto Bay and link them riders to Miami-Dade Busway and Metro Rail service. There are also several parks and recreational facilities available in both communities being compared. Overall, the city of Miami provides services to its citizens that are useful and money well spent. Population of the community analysis. City of Miami. 70% of the population of the city of Miami is Hispanic or Latino. 19.2% are Black or African American, and 11.9% are white, non-Hispanic. Having access to education is easily available to all who wish to complete or further their education. Miami-Dade College is a major community college in Miami, Florida, with several campuses available throughout Miami-Dade County. Three main campuses of Miami-Dade College reside within the city of Miami. Population issues exist in the lack of college education within the community, with only 23.5% of the community having higher education. Regarding communicable diseases, the most common is chlamydia, which infects 65% of the population, and these are only the reported cases. Safe-sex practices should be a community priority. Heart disease and cancer are the two leading causes of death in the city. A primary health concern throughout the state of Florida is cancer, which is the second leading cause of death in the city of Miami. Cervical cancer in 2009 affected approximately 11,000 women in the United States. 800 of these women lived in Florida. In comparison to Miami-Dade County, Broward County had a 5.2% incidence of cervical cancer between 2011 and 2013, and Miami-Dade County has 6.6% of incidence between 2011 and 2013. The city of Miami has access to parks and beaches dotted around the entire city. The windshield survey revealed parks that have incorporated trails and machinery to conduct weight training and stretching exercises. Citizens of the city of Miami have access to areas where they can perform exercise, and it promotes general well-being. The city also offers many options regarding healthcare. Baptist Health South Florida offers emergency care, inpatient and outpatient services to include diagnostics such as lab work, radiology, endoscopy, community referrals, home health services such as visiting nurse, and a variety of urgent care and primary care services. There are also community health clinics that provide services based on a sliding scale of the patient's income, such as Borinquen Medical Centers and Community Health of South Florida. The leading cause of death is heart disease in the city of Miami. Therefore, general health status in specific chronic disease prevalence should be a priority topic to be addressed for the city. Health-related quality of life and well-being is another topic of Healthy People 2020 that should be addressed. A staggering 29.9% of the community lives below the poverty level, and this influences the quality of life of the individual and their respective families. A determinant of health includes the individual's weight. In Miami-Dade County, Florida, 67.4% of its almost 2.5 million residents are obese or overweight. Targeting to reduce the rate of obesity is a community health initiative of the county, which includes the city of Miami. Examples of change found in the community to help support the reduction of overweight or obese citizens include installation of bike racks, training staff members of child care centers about nutrition and physical activities, revised menus of child care centers to include healthy meal options, private development of safe street access to citizens, and promote support breastfeeding through the commitment of birthing centers to earn baby-friendly status hospital designation. Environmental analysis. Miami-Dade Water and Sewer Department is responsible for the water supply and sewage disposal for the city of Miami. Drinking water from the tap in the city of Miami is water that meets and exceeds local, state, and federal requirements. Sewage disposal, solid hazardous waste disposal, air quality, and vector control are all readily available for the city of Miami via Miami-Dade County. There is a department responsible for environmental resources as mentioned above with contact numbers via the Miami-Dade County website. One environmental issue noted is the availability to dispose of solid hazardous waste. There are collection sites dotted within the county, but the sites are only open Wednesday through Sunday from 9 a.m. to 5 p.m. The timing may make it difficult for citizens to be able to dispose of materials such as oil-based paints, pesticides, solvents, pool chemicals, unbroken fluorescent light bulbs, and electronic waste. Overall, the environmental services are well satisfied within the city of Miami. Government and public policy analysis, access to information, and community needs. Access to information regarding budget, community meetings, and information on community officials for the City of Miami is great. Visiting the City of Miami official website grants access to all budget information, recorded community meetings along with meeting minutes, live coverage of community meetings held almost weekly along with agendas for the meeting. There is also an archive with videos of meetings held in the past. The access to information regarding the City of Miami along with the request of services is easily available on the city website. Public officials all have emails posted where they can be contacted as well as office numbers. Community meetings are held in the City of Miami City Hall, and only topics for discussion on the posted agenda will be addressed with the public. There was no open floor to any topic a citizen may have a concern over. When the citizen attending the meeting wants to address a topic in the agenda, they are allotted 1 minute to voice their concern. They must state their full name and address as well. The latter mention was frustrating for me because 1 minute is not enough time to address a concern, especially if there is dialogue between the citizen and the council member responding to his or her concern. Community issues to be addressed. 6 community needs as perceived by a community health nurse. 1. Reduce the rate of obesity within the city of Miami. Prevention is key in order to have a healthy community. If individuals are obese, it places them at risk for heart disease, the number one cause of death in the city. By addressing this issue, overall health of the community will improve. 2. Educate on the importance to practice safe sex. Chlamydia is the number one communicable disease in the city of Miami. Chlamydia is preventable if condoms are used correctly during intercourse. Teaching the public on the importance of protection during any type of intercourse is important. 3. Reduce the spread of Zika virus. Educating the community on how to prevent mosquito bites, along with draining areas with standing water, is a positive way to reduce the spread of mosquitoes that may have the virus. 4. Bus stops with benches and protection from the elements should be available for all stops. Citizens need protection from the sun and rain to reduce injury and exposure to intense heat and UV rays. 5. Well-lit areas for walking at night. Safety is a priority for all residents, not only for crime prevention, but prevention of personal injury. 6. Ability to dispose of hazardous waste. If citizens can easily dispose of waste, there will be less inclination to dump waste incorrectly and harm the environment. Prevention is the theme of the list, starting with physical health, primary focus to prevent heart disease, reduce communicable disease, then personal safety. Community health issue, Zika virus, a global problem as well as a local problem. The City of Miami has on its official webpage a complete guide on how to prevent the Zika virus from mosquito bites, available in English, Spanish, and Creole. Aerial spraying to kill mosquitoes along with door-to-door spraying for mosquitoes, and tablets and storm drains to kill mosquito larvae are all an effort to control the population of mosquitoes. In comparison to the city of Miami, the Ministry of Health in Brazil reports a drop in the Zika virus infection rate by 87% due to a countrywide effort to combat mosquitoes, specifically Aedes aegypti, the breed of mosquito that carries the Zika virus. In Brazil, there is an effort to collect tires that serve as breeding sites for mosquitoes that carry the virus, as well as spraying to kill mosquitoes. Also on the website of the Ministry of Health of Brazil, there is information for the public on how to prevent contracting the Zika virus, similar to what is available on the City of Miami website. Efforts have been fruitful in combating the transmission of the virus. A community health nurse could have interventions that are geared toward educating the public. For example, creating information leaflets to be distributed in areas known to have the Zika virus as well as surrounding communities, and how to prevent mosquito bites as well as how to reduce breeding grounds for mosquitoes. This completes the presentation. The next 3 slides contain the references. Thank you.